Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Okay, have you ever heard that saying women's health is a mystery? Well, it really shouldn't be. But sometimes it feels like research is kind of playing catch up, especially when it comes to like heart health. Here's a stat that kind of startled me. Cardiovascular disease is the leading cause of death worldwide. And get this, in some parts of the world, like Europe, there were actually more new cases of heart and blood vessel diseases in women than in men back in 2019. Crazy, right? For years, we've kind of thought of heart problems as a guy thing, but clearly that's not the whole picture. And that's where this deep dive gets really interesting. We're taking a close look at a brand new study that really caught our eye. It's all about the possible link between certain gynecological conditions, things like endometriosis and polycystic ovary syndrome, and the risk of developing heart problems. We've got the original research article right here from the journal Heart, the actual science, and we've also got a helpful explainer article from Medical Express, to help us break it all down. So walk us through this study. What were the researchers trying to find out, and how did they go about it?
Yeah, so the big question they wanted to answer was whether women with non-cancerous gynecological conditions were more likely to develop heart or blood vessel diseases compared to women without these conditions. To do this, they analyzed a huge amount of data from 28 different studies. We're talking over 3 million participants combined.
Wow, 3 million participants. That's massive.
It is. It is. That's what's called a meta-analysis. It's where researchers combine data from multiple studies to try to get a more comprehensive and reliable picture.
So did they find a link?
Yes, they did. The study found that women with conditions like endometriosis, a condition where the tissue that normally lines the uterus grows outside of it, or polycystic ovary syndrome, a hormonal disorder that can cause irregular periods and cysts on the ovaries, had a significantly higher risk of developing cardiovascular disease.
And we're talking about like serious events like heart attacks and strokes.
That's a big deal, especially considering how common those conditions are. Were endometriosis and polycystic ovary syndrome the only conditions they looked at? Those were two of the main ones that they focused on for sure. But the term non-malignant gynecological diseases, meaning non-cancerous conditions, includes a lot of other issues too.
Oh.
Things like adenomyosis, where the lining of the uterus grows into the muscle wall, uterine fibroids, which are non-cancerous growths in the uterus, painful periods, irregular cycles, heavy menstrual bleeding, and abnormal bleeding. Things that many women deal with at some point in their lives.
Yeah, for sure. This is where it starts to feel kind of personal for a lot of us. If there's this connection between these common conditions and heart problems, what does it mean for the women who have them?
Well, it really highlights how interconnected our bodies are, and how important it is to kind of view women's health holistically.
Okay.
It's not just about treating the symptoms of these conditions, it's about recognizing the potential long-term impact on overall health, including heart health.
So it's like a wake-up call to be extra vigilant about your heart health if you're experiencing any of these conditions. It's not just about, dealing with the immediate discomfort. It's about the bigger picture.
Exactly. This study really underscores the need for doctors to have these open and honest conversations with their patients about this possible connection. They need to encourage women to make those healthy choices that could reduce their risk of developing heart problems down the line.
Okay, so this all makes sense on the surface, but is it really that straightforward? I feel like there are always nuances and limitations with research like this.
You're absolutely right. No study is perfect.
Yeah.
And this one acknowledges some important limitations. One thing they point out is that many of the studies they analyzed didn't fully account for other factors that could also contribute to heart disease.
Yeah.
Things like genetics, lifestyle choices, smoking, or other pre-existing health conditions. It's a complex web of factors, and it's tough to isolate just one.
So it's not like having one of these conditions automatically means you're destined to have heart problems, right? It's more about understanding the potential risk and taking steps to mitigate it.
Exactly. And another important thing to remember is that this was a meta-analysis of observational studies. This means they were looking at patterns and associations, but they couldn't definitively prove that these gynecological conditions directly cause heart disease. To establish a clear cause and effect relationship, more research is definitely needed. That's a really important point to remember. Yeah, it's not about a guarantee or anything. It's more about understanding that potential risk and then figuring out how to, how to mitigate it, how to lessen it. This isn't about like causing panic or anything. It's about, empowering women to be proactive about their health.
It sounds like we're just like scratching the surface here. Are there other like unanswered questions the researchers highlighted, things we need to dig into more?
Yeah, for sure. One thing the authors really stressed was the need for more research into how these conditions might influence heart health across, a woman's entire lifespan.
Right.
We need to understand how these risk factors might evolve and change as women age, and go through different hormonal transitions like menopause.
So we're missing pieces of the puzzle. And without those pieces, it's hard to see the full picture and develop like really effective preventative care and early intervention strategies. Right?
Precisely. Imagine if we could identify women at higher risk, early on. Could we maybe tailor lifestyle interventions or even medical treatments to protect their heart health throughout their lives? That's the exciting potential here.
It's like, whole new frontier of women's health. Now let's go back to the specific findings for a minute. You mentioned the study looked at a range of conditions under the umbrella of non-malignant gynecological diseases. Can you kind of break down some of the specific conditions they investigated and highlight any noteworthy findings related to each one?
Absolutely, yeah. They examined a really wide spectrum of conditions, but let's focus on a few key ones for now. First up, endometriosis. This is a condition where tissue similar to the lining of the uterus grows outside of the uterus, causing pain, irregular bleeding, and sometimes infertility. The study found that women with endometriosis had a 30% higher risk of developing cardiovascular disease compared to women without the condition.
30%, wow. That's a significant increase. It really highlights how important it is to take endometriosis seriously. Not just for the immediate discomfort it causes, but also for its potential long-term health implications.
Exactly. And next we have polycystic ovary syndrome, or PCOS as it's often called. This is a hormonal disorder that can cause irregular periods, excess androgen hormones, and cysts on the ovaries. The researchers found that women with PCOS had a 28% higher risk of developing cardiovascular disease.
Okay.
So similar to endometriosis, it's a reminder that PCOS isn't just about, reproductive health. It can have much broader implications for overall well-being.
Okay, so endometriosis and polycystic ovary syndrome both seem to be, strongly linked to an increased risk of cardiovascular disease. What about some of the other conditions? Did the study reveal any notable findings related to them?
Well, the study focused primarily on endometriosis and PCOS. It also included data on other conditions such as dysmenorrhea, which is characterized by painful periods, and irregular menstrual cycles. Although the data on these other conditions wasn't as extensive as the data on endometriosis and PCOS, the findings still suggest that women with these conditions might also face an elevated risk of cardiovascular problems.
It's interesting that even seemingly less serious conditions like painful periods or irregular cycles could potentially be tied to heart health in the long run. Is there a common thread, do you think, connecting all these conditions and their impact on cardiovascular health?
That's a great question, and it's something researchers are, actively exploring. One theory is that chronic inflammation might be the missing link. Many of these gynecological conditions involve some degree of inflammation, and we know that chronic inflammation throughout the body can contribute to the development of heart disease over time.
So could it be that the constant, low-level inflammation that these conditions often cause is slowly damaging blood vessels?
Yeah.
Setting the stage for heart problems down the line.
Exactly. It's, it's slow burn, but it can have a significant impact over the long term. And it's a reminder that inflammation isn't just something you experience when you have an injury or an infection. It can be a silent underlying force that affects multiple systems in the body, including the cardiovascular system.
This is really making me rethink, everything I thought I knew about women's health. It's a lot to process, but it's so important. Now, before we wrap up, let's shift gears a bit and talk about what this all means for women and their healthcare providers. What are the practical takeaways from this study? What should people be doing?
I think the most important takeaway is that knowledge is power. By understanding the potential link between these gynecological conditions and heart health, women can, make more informed decisions about their health care and their lifestyle choices. This means, talking openly with their doctors about any concerns they might have, getting regular checkups, and taking steps to reduce their risk of cardiovascular disease.
And it's not just about women taking action, right?
Yeah.
What role do healthcare providers play in all of this?
Oh, healthcare providers have a crucial role in raising awareness about this connection and making sure their patients are informed, right? They need to be proactive in screening for these conditions, discussing the potential cardiovascular risks with their patients, and offering personalized guidance on like lifestyle modifications and preventative measures.
It sounds like a team effort. Women need to advocate for their health and seek information, and healthcare providers need to be aware of these risks and provide, appropriate support and guidance.
Precisely. It's a partnership that can lead to better outcomes and ultimately healthier lives.
This is giving me a lot to think about for sure. But let's get down to brass tacks. What are some specific, like, actionable things that women can do to protect their heart health, especially if they have one of these gynecological conditions?
Well, it really does come back to those like healthy habits we've all heard about. But let's break them down and see why they're so crucial in this context.
Okay, let's do it. What's first on the list?
First and foremost, diet plays a huge role. We need to focus on a heart-healthy diet rich in fruits and vegetables, whole grains, and lean proteins. Think, Mediterranean diet style, lots of fresh produce, healthy fats, and, minimizing processed foods.
That makes sense. But haven't we always been told that, those kinds of dietary changes are good for everyone? What makes them so specific to women with these conditions?
You're right. A healthy diet benefits everyone, absolutely. But this research suggests it's especially important for women with these conditions because it can help manage inflammation. And remember, chronic inflammation seems to be like a key player in that link between gynecological conditions and heart disease.
So by reducing inflammation through diet, we're essentially tackling one of the root causes of the problem.
Got it. What about exercise? Where does that fit in?
Exercise is absolutely essential. Aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week.
Oh. And it doesn't have to be anything, crazy. Brisk walking, swimming, dancing, anything that gets your heart rate up counts.
I know. We've all heard that advice a million times. But I guess it's worth repeating because it really does make a difference, right?
It really, really does. And it's not just about the physical benefits either. Exercise can also work wonders for managing stress, which is another, major factor when it comes to heart health.
Yeah, stress, the silent killer.
Yeah.
What are some effective ways to kind of keep stress in check?
Yeah.
Asking for myself, and I'm sure many of our listeners out there.
Well, we all need healthy coping mechanisms, right? Things like yoga, meditation, spending time in nature, or even just, deep breathing exercises can make a huge difference.
Yeah.
And if you're feeling overwhelmed, don't hesitate to, seek professional help. A therapist can provide like valuable tools and strategies for managing stress effectively.
That's a great point. It's easy to forget that, taking care of our mental health is just as important as taking care of our physical health. Okay, so we've covered diet, exercise, and stress management. What else should women kind of keep in mind when it comes to protecting their heart health?
It's also essential to be aware of other risk factors for cardiovascular disease, such as smoking, high blood pressure, and high cholesterol. If you have any of these risk factors, it's crucial to work with your doctor to manage them effectively.
It's all about being proactive, informed, and taking control of your health.
Exactly. And remember, this is an ongoing journey, not like a destination, right? Small, consistent changes over time can have a huge impact on your long-term health.
This has been such an eye-opening conversation. I have to say, it really makes you think differently about women's health and the importance of, advocating for ourselves and really understanding what's going on in our bodies.
Yeah, I agree. I hope this deep dive has, empowered listeners to have those important conversations with their healthcare providers and to really prioritize their heart health.
I think it has. Before we go, I want to leave our listeners with one final thought to ponder. This study focused on women who already have these gynecological conditions, right? But what about prevention? Are there things women can do, like before developing these conditions, to potentially, reduce their risk? It's a question worth exploring for sure, and it highlights the need for, even more research in this area. Thanks for joining us on this deep dive, everyone. Until next time, stay curious, stay informed, and stay healthy.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.